Is there like a checklist of like, here are the 5 things you want to do every day? 6. Great. Tell me what they are.
So what I'm going to actually start with is this framework, right? The 6 components of brain health. If there is imbalance in any of these 6 factors, then we are going to get downstream dysregulation, right? So we want balance, the right amounts at the right time in the right place of toxins, right? We're going to get toxins in our brain. That's just part of living on Earth today. And it's part of cellular metabolism. There's waste. And so we need to be able to get rid of that. So toxins, the right amounts in the right place at the right time. Nutrients. Again, you talk a lot about fasting and metabolism and how crucially important this is, not just for brain health, but right, for bone health, for healthy metabolism, right, for cancer prevention, for diabetes prevention, for heart health optimization. We need to be aware of our metabolism and our nutrients, right, at a macro level in terms of carbohydrates, fats, and proteins, but also at that micronutrient level. Do we have enough minerals? Do we have enough B vitamins? Do we have enough antioxidants in order for our cells to be optimally functioning? Because that's what we're looking for, is optimization. And then third, we want to look at stress, right? Many people in your position, right, where we're considering being a caregiver. Caregivers for someone with dementia are anywhere from 2.5 to 6 times more likely to be diagnosed with dementia later in their lives compared to those who never serve as caregivers.
Oh, wow. Wait, stop for a second. So that means now at almost 55 years old, as I'm caring for my parents, definitely the stress has gone up. And that's leading me to the path, potentially, of what I'm caring for my parents for.
That's precisely right. And this is terrifying when you see spouses caring for each other, right? Like if your mom was to serve as the primary care partner for your dad, that can put a very high burden on her, especially if he becomes unable to keep his circadian rhythm as the disease progresses and he's awake at night. Now it's interrupting her sleep. Many care partners, they're so dedicated and they're just such an inspiration, and yet they become martyrs. They're not getting the exercise. They're not eating well. Their identity gets lost in caring for this person. And so they lose their friends. They're not socializing. All of those brain protective things that we know are so beneficial get put to the wayside in order to care for that person. So that's too much stress, right? What we want is enough stress that we're excited to get out of bed and seize the day, right? We have purpose and meaning, whatever that is for you. You're engaged in some sort of physical activity that keeps you, right? Use it or lose it. You need to use your cognitive function. You need to use your physical body in order to maintain enough stress that we're kind of pushing against that edge and we're not losing our function. So toxins, nutrients, stress, structure. So you mentioned your parent is suffering potentially with dementia or Alzheimer's. Are you at genetic risk? Becomes one of the questions that comes up, and I think is really important to answer when we're in our 40s, 50s, 60s, before we're starting to experience symptoms, because this can motivate us. If we know our ApoE status, APOE, if we carry 1 or 2 copies of ApoE4, then we know that we have to work harder than our spouse or our neighbor who doesn't have that genetic risk. And we need to start looking earlier at our risk factors so that we can mitigate them sooner. And again, delay, prevent, and then potentially reverse any cognitive decline that's already happening. So structure comes in macro and micro as well. So that microstructure is that genetic molecular structure. Now the macro structure, I know you can probably speak to even better than I can as a chiropractor. We need to be able to get blood to our brain and out of our brain. We need to have, our head carriage can't be too far forward. If we're in chronic pain, the cortisol that comes with that can become toxic to the hippocampus, the memory center of our brain. And if we can't keep our airway open at night, if we struggle with sleep apnea, this essentially becomes mild brain damage each night. Hypoxia is very, very toxic to the brain. We need to be able to get oxygen and fuel to the brain. And especially at night, if we suffer with sleep apnea, we're not getting the restorative, healing REM sleep and deep sleep that we so desperately need to maintain cognitive function.
Yeah.
So go ahead.
Structure was number 5, 4?
4.
Okay.
So number 5.
Go through the last 2.
is infection, and number 6 is signaling. So infections, there's a handful that are really important when it comes to cognitive function. One is P. gingivalis. So gingivitis, the bacteria that cause gingivitis, when they get into our bloodstream, they can cause cardiovascular risk, but also directly trigger the production of beta amyloid in the brain. So we want to make sure, you talk about this so much. So I know your audience is very familiar with this adage that health starts in the gut, but the gut starts in the mouth. So we've got to maintain really good oral hygiene so that we can maintain good cardiovascular health and good brain health. Really important. And then also there can be kind of latent infections underneath root canals, in cavitations associated with
that's a whole can of worms. That's such a can of worms, but for some people it's really important. So I hear you on that.
I measure LPPLA2 on advanced cardiometabolic workup. And if I see that regularly, 2 or 3 times, if I see that elevated and someone tells me they have maybe complicated dental history, then I'm referring out to a biological dentist. If you had told me in training that root canals would be associated with complex chronic disease and outside of the mouth, I would have thought you were totally nuts. But I have seen it enough now. I've seen this play out with enough patients that oral health, it's so, so, so important. So signaling, let me go through these other infections. So P. gingivalis in the mouth, and then also herpes simplex virus 1 in particular. So if you get regular cold sores, that's something, I'm a naturopath, right? I'm not reaching for pharmaceuticals that frequently, and there's a lot we can do with lysine and lemon balm and some other antiviral herbs that you can do for prophylaxis. However, if you're prone towards regular herpes outbreaks, repeated herpes outbreaks, then it's important to get ahead of those. And I typically will give my patients, certainly acyclovir or valcyclovir, to have on hand with travel, with stress, anything that's going to trigger an outbreak. And I'm pretty quick to get aggressive about that, just because the research is pretty clear that when we treat that relatively aggressively versus when we don't, the people who treat are at lower rates of dementia. Because again, that virus that hangs out in the nervous system triggers the production of neurodegenerative processes. So P. gingivalis, herpes simplex, COVID is another one that comes up, and this is a little bit different mechanism.
Yeah.
So this one tends to create more hypocoagulability. And so it's in the vascular system, but can prevent good blood flow to the brain. So we come at that a little bit differently in that we're trying to reduce inflammation in the cardiovascular system. So looking at things like lumbrokinase and nattokinase, that kind of thing to help with the viscosity of the blood. And then the Lyme spirochetes are another one. We know that syphilis, another spirochete, has a neurological presentation. Lyme also has a neurological presentation. And so it's important to be screening for these Lyme and Borrelia, Babesia, Bartonella, or Ehrlichia, that and the co-infections, so not just Borrelia, the kind of classic Lyme disease, but also the co-infections that can have an impact and wear on the immune system and put us at higher risk for cognitive decline as we age. So those are the infections that I really like to kind of be, if you go on PubMed and you look at H. pylori and dementia, there's a connection. Generally, we want to keep our infectious burden overall to a minimum so that our body's not spending time and effort and energy combating those, right? Protecting against them. But we can spend our time and effort and energy and resource creating new neurons and connections between them. The last one is signaling. And this is a really exciting conversation, I think, with your population and your audience in particular, because of the new research that came out recently looking at postmenopausal women over 65 in the Medicare system. 11 million women were included in this study. And it showed, I think unequivocally, that bioidentical hormone replacement as we age reduces our risk of all-cause mortality, cancer, dementia by about 10%, and then cardiovascular disease. So there was a lot of confusion around the Women's Health Initiative study that came out in the early 2000s. And that has completely been turned on its head. And it's really, I think, an empowering time showing women that you don't have to get off by a hormone replacement. That was kind of the words of wisdom from people who are suffering with two people who are suffering with severe hot flashes or sleep deprivation or mood changes as they went through menopause. It's like, you can stay on this, but not for too long. And for many people, they were talked out of even getting on it. And I talk to patients in my practice all the time who are terrified of hormone replacement, when in fact, it seems to really be beneficial for almost all health outcomes as we age. And I didn't even mention bone density because that wasn't included in the trial, but that is another, the reduction of the rates of osteoporosis and osteopenia are very clearly understood with the addition of estrogen in particular.
You know, it's interesting as I'm listening to you, I'm thinking, wow, like we have really redefined the path into these aging years. You know, and I think our parents are, like you said, remnants of an old healthcare model. And this kind of discussion you and I are having right now, they didn't get that discussion. Right. And so, you know, I think for, you know, like my generation, I'm a Gen Xer, like in that generation, we are all starting to look at aging from a new lens. And I hope that my kids who are Gen Zers, by the time they come into this conversation, it'll be very clear that lifestyle matters when you start to age. Of the 6 you just said, the 2 that as I was listening to that, I was thinking, yeah, that's an amazing list. And if I was somebody who was just trying to understand how to prevent Alzheimer's and dementia, I would be overwhelmed with those 6 things, because how can I'm managing an aging parent, I'm managing my own life, and now I got to manage those 6 things. But when you break it down, I feel like the easiest door in to increasing your immune system, to balancing your hormones, to helping your body detox is the second one, your metabolism. And this is why I'm such a fan of fasting and looking at our glucose levels and our ketone levels and how that affects brain function.